Welcome, everyone, to the Lucky Me podcast. I'm so happy that all of you are here listening to the second episode. I just want to say a big thank you to all the love and the support I received from my first episode. I didn't expect how much you guys would relate to my advice and my story of how I grew up and, being in your 20s and all the crazy stuff that we might go through. Thank you for all the love, and I just appreciate it so much. I am recording this again. You guys can actually watch this episode on my YouTube channel, or if you want to listen to on Spotify, you can listen to it and you can watch it as well. So, video version or just audio, whatever you guys would recommend. This episode, I want to talk all about my cancer journey, being diagnosed with cancer, treatment, how I felt, and post-cancer, what it's like. I want to shed light on cancer awareness and how important it is to get checked for your health and speak up for your health. If you ever feel like there is something off or wrong, or you just don't feel right, you need to see a doctor and get checked, because what's the worst that can happen by getting a blood test or a scan done? You figure out what's wrong with you sooner rather than later. And I hope my story can prove that to you guys, how important it is to speak up. And that's all you have is your health. And if any of you have gone through cancer treatment or have a family member or a friend, I'm so sorry that you ever had to go through that or are currently going through that. I know it's scary and it's frustrating and you're angry and you feel numb. And I know a lot of people, if you go through cancer treatment, you just feel out of your body, out of control with your body and out of touch with reality. And it's an emotional roller coaster that not many people understand. I understand. And I know it's scary. And I promise you'll get through it. And there are so many resources like support groups and books. I've read books about it, and you can go on YouTube and see other people's vlogs and stories, and it helps because you're not alone. And I know it's scary right now, and I know you feel like nobody understands, but I understand. And if you ever need someone to talk to, I'm here. And I understand what everybody's going through if you've ever gone through it. So never forget that, and you will get through it, and it will all pass. That being said, I want to share every single thing that I experienced. I did document my cancer journey on YouTube. I vlogged it, but there was a lot that I didn't share and talk about because it was a crazy experience and I didn't really know how to process everything, and I still don't. So I'm going to try to do my best today to share my cancer journey. I want to start back to high school. That's kind of where it all started. 17 years old, I remember having weird symptoms like back pain, bloating, nausea, fatigue, but the main symptom that I had was face pain. I had this stabbing, aching pain right next to my ear by my jaw, and I saw a dentist and they said it was just TMJ. I would see my gynecologist for the nausea and the back pain and the fatigue and the bloating. And, I would just be told it's birth control, get off birth control. But I just wasn't feeling right. Like I couldn't stand up for long periods of time because the back pain was so severe. It was right at my bra line. And that's kind of where it all started. But the face pain was the worst of it all. I couldn't, if I was brushing my hair and my hairbrush kind of like hit the side of my face, or if I touched the side of my face with a beauty blender or brush, I would scream out of agony because it felt like I was getting stabbed in the face. I was given like a night guard kind of retainer because they thought it was TMJ. But I kind of just moved on. I was told I was fine. All the time I was told I was fine. I go to college and I'm still having these exact symptoms in North Carolina. I went to High Point University. I was having the exact same symptoms: nausea, back pain, bloating, fatigue, and the face pain. I was in a car accident my freshman year, and I went to the hospital. I broke a rib, and the back pain was like obviously even worse because all my nerves and everything was just so tight. My muscles were so tight. Obviously, you break a rib, you can't do anything for a broken rib, so you kind of just deal with it, take some pain medicine. But nothing explained why I was having such bad back pain and the face pain and the nausea and the fatigue and the bloating. Nothing really explained anything. I would do blood tests all the time to just figure out what it was. Everything came back normal, and I was told I'm fine. Every doctor I saw, they would say, "You're fine, you're fine, you're fine." So then time goes on, and I move to Miami, and I'm still having this back pain and face pain. So I see a back doctor, a back and spine specialist doctor in Miami, Florida. And I did tons of MRIs, tons of x-rays, tons of CT scans, and nothing looked wrong. Nothing. There was 2 spots on my spine that were like a little unusual. There was one by my brain, and we kind of just assumed that was why, but he could not operate on it because it's too dangerous, because it was in my brain, basically. So I would do epidural shots in my neck. They would go through my neck, kind of to like my throat. Epidural shots are very common for people who have back pain. It kind of just numbs the area of your back and spine, but it wasn't working. Like I would do them and they weren't working. And my doctor was so shocked and confused, and he never gave up though. He was on it. We're going to do this test. We're going to do this scan. We're going to figure this out. He promised me, he's like, "I promise you, we're going to figure it out." I was also losing a ton of weight, which my diet never changed. I just was losing so much weight. So I go in for my follow-up appointment after my epidural shots. I say, it didn't work. I still cannot like sit up straight. I can't stand up. I just don't feel good still. I always said I just don't feel good. And I go in for my follow-up and I say the epidural shot didn't work and my face still hurts. He knew that the face pain was so severe, and we kind of linked it to, you have nerves in your face that connect down to your back and spine. So he said that's why you have face pain, is because it all connects. And so I go in and I say, I found a lump in my face. Where my face pain hurts, there's a lump in it. And I remember so vividly the fear in his eyes. And I remember he said, "Okay, 1 second." I remember him leaving the room and kind of yelling, like, "We need her to get an MRI today. Somebody needs to get an MRI for her right now, and she needs to see an ENT doctor," which is an ear, nose, and throat doctor. And I don't really remember much. I just remember the panic in his voice. And I believe it was like the next day, or it might have been the same day. I go and get an MRI done, a specific MRI done of my face and a CT scan. And I remember I go in for my follow-up, and he says, "It's a mass in your face. You're too young to have cancer though, so you don't need to worry. Don't worry, but it's a mass in your face, and I'm on the phone right now getting a hold of another ENT doctor, and you're going to go see this guy to figure out what it is to make sure it's not cancer, but I promise you it's not cancer. You're too young." Yeah, which, I mean, anybody can have cancer. Babies have cancer. So, but yeah. So I make an appointment with this ENT doctor, and I go in, and I remember him touching it, and I was crying in pain because it was so painful. And mind you, the mass was small. It was small. I like caught it when it was still pretty small. So I remember going in and I, tell him my symptoms. I tell him my history with how I feel and all the scans I've gone and how my doctor referred me to him. And he said, it's an infection. We're going to put you on antibiotics for 2 weeks. So I start taking these antibiotics for 2 weeks, and they made me so sick. I would stand up and be so dizzy. I got sugar buds, which I don't know if if anybody understands what these are, but if you eat too much sugar, you get these white bumps on your tongue. I got them all over my tongue, and they're very, very painful. I was nauseous. Like, I would almost throw up every single day. I got hives all over my body. So I call the doctor and I say, this medicine is making me very sick. I need to switch medicines. And I remember her saying, has the mass gone down? Because it's already been a week and a half and it should be completely gone. And I said, no, it's the same size. And she said, okay, we need you back into the office. So I go back into the office. Also, side note, my dog is drinking so much water. If you guys can hear that, I'm so sorry. Every episode, there's some sort of technical difficulty, or my dog is drinking water, eating food, whatever. So, anyways, I go into the doctor again for a follow-up, and he's like, this should have been gone. This should be completely gone by now, and it's not. So he recommends that I get a biopsy done. I go to a different doctor to get the biopsy. I have a consultation. He puts an ultrasound to my face. We see the mass. We can measure it. We see it all. I tell him my symptoms, and I have to get a biopsy done the following week. So, waiting. I'm just thinking it's, just a typical mass, because I was told by multiple doctors, it's there. You do not need to worry. There's nothing to worry about. This is a weird location. Like, you're fine. I was told that multiple times. So my mom flies into town and I get this biopsy done. I remember being in the bed and they wheel me into the room and they said, this is going to be very easy. It's going to take 2 seconds. You're not going to feel anything. You're fine. Like, it's super, super simple. The needle's very thin. I have never experienced so much pain in my life that I completely blacked out. My mom told me, because she was in the other room, she heard me scream like bloody murder. She's never heard me scream like that. She's never heard me cry like that. She's never experienced anything like that ever. And oh, hi, Shiloh. Shiloh's here. Shiloh's here. If you're watching this, can you sit down for me? Can you sit? Oh, you're a good girl. Yeah. So, anyways, like I was saying, I completely blacked out. I think I passed out because of the pain. And I remember when I woke up kind of from all the pain, him being at the foot of the bed saying, I have never experienced somebody in this much pain from a biopsy. I don't know why you just experienced this much pain. This has never happened before. So then it's a waiting game. I'm waiting to hear the results back. I'm waiting for the ENT doctor to call me and go over everything with me. And obviously, I'm scared because worst case, it's cancer. But I was told for so long that it was nothing and I have nothing to worry about. So I was torn. I was torn with, it could be, but it's most likely not. But of course, when you're going through it, you're thinking the worst case scenario. So I was thinking the worst case scenario for about 2 weeks. At that point, I'm like, I have cancer. I'm going to have to go through chemo. I'm scared. I don't know why this is happening to me. I don't understand. So I remember the fear for weeks on end. And I remember I decided to go to the beach with one of my friends at the time. And I remember thinking, you know what? It is nothing. I'm okay. I have nothing to worry about. It was the first day that I let all that fear go. It was the first day that I just trusted that everything was okay and I was fine and I had nothing to worry about. That's the day that I got the call. I remember sitting at the beach. and my doctor calling me, and he said, "Can I talk to you right now? Is it a good time to talk?" And I said, "Yeah, what's up?" And I remember him saying, "It's malignant. It's a tumor." And I don't remember really anything else that he said to me. All I do remember is him saying that it's a tumor and my mom needs to call him immediately. So I kind of just said, "Okay, okay, okay." And I hung up the phone. I called my mom, and I remember just saying, "You need to call my doctor right now." And the panic in her voice, she was like, Why? What's wrong? What's wrong?" And I said, "You have to call the doctor right now." And she said, "You need to tell me right now what's going on." And I said, "It's a tumor." She hangs up the phone and she calls the doctor, and I don't know what she said to him. I don't know what he told her. I don't really know anything like that. But I remember leaving the beach, and I remember my dad and my mom calling me as like a joint call, and my dad crying and them just saying, "You're going to be okay. It's going to be okay." But I was just confused because I didn't know what the word malignant meant. I didn't know what the word benign meant. I didn't really know if a tumor meant cancer. Nobody was really telling me anything besides just they were kind of, everyone was talking to each other except for me. No one was really telling me what was going on. I don't really remember that day. After that day, um, but the next day is when I grabbed my camera and started talking on my camera. I guess it was a way to cope my thoughts and how I was feeling, but nobody was telling me what was going on. Nobody made it clear what it was because, again, I had no idea what anything meant. I didn't know a malignant tumor meant cancer. I had no idea. But nobody did. No, none of my doctors really understood because the biopsy results came back as a cynic cell carcinoma. A cynic cell carcinoma is a cancer in your head and neck. It's extremely rare. If you're diagnosed with it, you're a male and you're in your 30s, 40s, 50s. You don't get it as a female in your 20s. So nobody believed that that's what it was. So everyone was just like, "What the heck? Like there's just no way that this is what it is." So then it's panic mode basically. I didn't tell anybody. The only people that knew were my grandma, my aunt, my best friends, and I think just my close family, but I did not tell anybody. And my two neighbors. I didn't feel ready to tell people because I didn't know what was going to happen to me. I had no idea. But I remember the first conversation I really had with a family member was my grandma. She had ovarian cancer, and I remember she called me and she said, "When I was younger, I would see people with cancer, and I would think, what did they do so badly in their lives that they would have cancer?" And then she had cancer, and she thought, like, why me? Why does this have to happen to me? Somebody else should have this happen to them because I don't deserve it. And I remember her saying, "But why not me? Why wish this upon anybody else? This is something I have to tackle. This is meant to happen to me for a reason. And it might not make sense right now. It might be scary right now, and you might be so angry right now, but why wish this upon anybody else?" And that really changed how I looked at it. And you know what? I will admit, a couple days ago, I was still saying the same things. Why me? Why do I have to go through this? Why am I put under these circumstances that I don't even know if I can tackle? I don't know if I can get through it. I'm scared that I can't get through it. But why wish it upon anybody else? Why wish this fear? Why wish this pain? Why wish this medical issues on anybody else. And I will always remember her saying that to me forever. So I kept it quiet. I didn't really tell anybody. Um, Everything is just kind of up in the air. I was still living in Florida. I flew to LA because that's where I'm from, and my insurance was in California. So I flew to LA and I met with 3 different surgeons, 3 different oncologists that specialize in head and neck cancer. I saw one. The first one I saw, I remember him saying, your tumor is wrapped around your facial nerve. Your facial nerve connects to your whole face. And if we have to, I'm going to cut your facial nerve and you will lose function in your face. And I may have to cut your neck open a lot more than I probably want. And so you're going to have a big scar, but I can't guarantee that you'll be able to move your face again. And I just cried. I remember crying, and my dad and my mom being there. My dad said, we cannot let this happen to her. She's 20 years old. She needs to, I remember him saying, she needs to get married one day. She wants to get married one day, and she can't not move her face. I remember him saying that. I'm like, wait, what? I just want to be able to smile. I want to be able to move and move my mouth properly. So we left that appointment feeling very uneasy. And then we had another appointment like an hour later, and him basically saying the same thing, where it was a risky procedure and you can't really guarantee anything. If I remember him saying, if we have to cut open more, we're going to, so you're going to be left with a pretty hefty scar. Again, felt very uneasy about both appointments, and that was it for the day. The next morning, we had one last doctor's appointment to see if we wanted to go with him as the surgeon. And I had no hope. I'm like, great. Well, I'm not going to be able to move my face. I'm going to be left with a crazy scar on my face and my neck. But I have to do it. I have no choice. So we go to this appointment. This was at UCLA. And he basically answered every single thing that we were worried about. He was everybody was shocked still that that's what came back out of the the biopsy, was that it was a cynic cell carcinoma. He said that it's very treatable and it's a slow growing cancer and tumor. We want to get a PET scan done to make sure it didn't spread to your brain or your chest. And we have a plastic surgeon that will make sure that, we're just going to make sure that the scar isn't too big. We're going to take our time with your facial nerves, and we'll put putty in your face, because basically what they do is they take out a tumor and they take out a margin. The margin is just to make sure that they take out any sort of cancer cell that could be in there, and some lymph nodes. Because it was in the location that was in, I would have a hole in my face because there's not enough tissue to fill up the hole in your face. So they bring up a part of your neck muscle to fill in that area. If your neck muscle isn't that stretchy, so because I'm young and I have tight muscles, if it doesn't fill up that area, they put putty in your face. And that's kind of what the plastic surgeon was there for. It was to make sure that my face looks pretty. That was the goal, was to make it so my face looks pretty still and the same. We felt very confident with him. He was overly cautious. He wanted to get multiple scans done. He had great bedside manner. He was considerate and compassionate. He understood my fear and was really reassuring, and had a game plan and a big team behind him that was there to support him and to make this all safe and the best possible outcome ever. So we decided to go with him basically immediately, and I get a PET scan done. I go back to Miami, And then I fly back like a week later for 24 hours to get a PET scan done, which is a hefty scan. You can't eat you have to kind of fast for 12 hours, and then you can't eat the day of. Obviously, you can't have caffeine, drink anything. I think you can drink water. And then you sit in a chair for an hour, but you can't talk, you can't move, you can't do anything. You have to sit there in a chair for an hour because they inject you with a solution that will glow the cancer. So you have to really make sure that it doesn't go anywhere else to kind of mess up the PET scan. And then you're in the scan for another hour. A PET scan, you scan from head to your toes. That's your entire body you're scanning. So I do that, and then I obviously have to get a pre-op appointment. I go back to Miami, fly back to LA again for my pre-op appointment. And I was having bad chest pain too. So I had to go see a cardiologist. But I had to get all this stuff done in like a certain time frame. So it was okay to still do the procedure. Like I had enough time, but it had to still be close enough to the procedure. So it was like a nightmare. I was flying back and forth for only like 24 hours at a time. So the pre-op appointment is fine. You do your blood work, you answer a ton of questions. It's kind of just like a simple pre-op appointment. I had to do an EKG test because my heart and my chest were feeling not the best, and then I had to go see a cardiologist. So we're gonna fast forward this. We're gonna fast forward it. Surgery day comes. Going in the morning. Obviously, don't want to do surgery. This is my first ever surgery. I'm scared. Um, it takes some time. It gets delayed a couple hours. Surgery, I remember going in, and at the time, still, I love this guy, still to this day, but at the time, my favorite artist was Machine Gun Kelly. And I think my favorite song off the album was Bloody Valentine, his first rock album. I remember getting wheeled into the operating room and they're playing Machine Gun Kelly. And then I remember laying there and I was like, I'm scared. I'm scared. I'm scared. I'm scared. And they're like, you're gonna be okay. Promise. You're gonna be okay. It's okay. I know you're scared, but it's okay. And I just start crying. And then I was out. That's all I remember was just being out. I wake up from the operation. My mom is there, but obviously I'm groggy. I don't remember anything. I had a lot of kidney problems because of the Pitocin that they were giving me. So I was in excruciating pain all night from the Pitocin. My kidneys were killing me. But the recovery process, I think I was in the hospital for 5 days, I believe. Um, all the nurses were great. There's not much to say about my recovery process. Um, just making sure I was on top of all my medication. And my mom, my dad were there by my side. It was kind of during COVID time, so only one person can be with me at a time. But no, really, I don't remember half of it because I was asleep during a majority of those days. So I don't remember my recovery besides the fact that it was okay. Obviously, I had pain. I had a drain in my head. I had like a hole in my head with a drain and it came down. So after being in the hospital, I go home and then I just recovering. Like I got so many flowers and meals sent to my house, but what was crazy was I couldn't eat. Like I was being forced to eat food. I had a lot of yogurt, but I couldn't open my mouth. Like I would talk like this. I couldn't open my jaw because it was so tight, but I could move my face. I could smile. I could smile a little bit. I could frown. I could pucker my lips, but I was able to move my face, and the procedure went amazing. The doctor did say we're going to wait. It's going to take like a week and a half or 2 weeks to find the pathology, and then we're going to go from there to see if we want to do chemo and radiation. So it was kind of just a waiting game to see about further treatment. But I remember when the pathology report did come in, I remember my doctor saying, I cannot believe that this is the cancer that you had. That's crazy how rare it is. So, um, I just remember, like, all the love and the support that everybody was giving me. That's when I did announce that I had cancer, was the day of my operation. I was ready to share it. I was ready to share to everybody. I posted a photo on Instagram, and then I just updated my journey kind of, um, with friends and family, and I received so many lovely texts and calls and messages and gift baskets and flowers, and it was it was amazing, how much love, and I didn't realize how many people cared. I think that was the biggest thing, is I felt like nobody really cared about what would go on with me, but so many people did. So, pathology report came back, it was that cancer, and then I had to speak to, somebody who would decide if I should do radiation treatment. Um, and I spoke to him, and he felt like, well, my doctor and him both felt like, because of my age and because of how my body would react to radiation, we decided to not do radiation because there would be more harm to my body than good, and instead just continue to see my oncologist a lot more frequently. So every 3 to 6 months, I go see my oncologist, to get new scans done and to just follow up with him, check in, and if I ever feel like there's something off or wrong, I go in sooner. So, and if it didn't catch what I was talking about before, the radiation would cause more harm to my body than good. We just outweighed the pros and the cons. So, after, you know, healing kind of, I have, still to this day, numbness in my face. I can't really feel half of my cheek. My ear, it's weird. I can feel my ear, but there's parts of around my ear and my neck and my cheek that I can't feel, which is huge. My doctor also told me I would not feel my ear anymore, and there's no way of getting out of that. Most people don't end up feeling their ear. I can feel my ear, which is amazing. There's just parts of my face that I can't feel. And obviously, not being able to feel my ear or not being able to move my entire face, I'd rather not feel my ear than have function in my facial nerve. So, yeah, still to this day, I don't really feel parts of my face, but I can smile. I can move my face. My mouth kind of is weird sometimes. It doesn't open properly sometimes, but I notice it, but nobody else really notices it. So it's okay though. So after going through treatment, I expected my life to bounce back. I thought, you know what? I've dealt with all this health issues and complications for so long. This is my time to shine. I'm gonna thrive. I'm gonna jump back to my life how it was before, and we're gonna keep it pushing. And I'm gonna not think about what happened. I'm just gonna move on. And that hit me like nothing else. Um, I hate to say it, but that is not what happens after you go through cancer treatment. It's a big reality check. I became so depressed after I had cancer. I became so traumatized and scared, and I developed OCD and PTSD. And it got to a point where I had to see a psychiatrist to be put on some sort of medication because I couldn't go anywhere. I was scared to drive my car. I was scared to do anything fun. I was scared to do anything fun because the day I found out I had cancer, I went to the beach and I had fun and I thought, I'm okay and nothing's going to happen to me. And that's when I found out. So I developed this thought that if I had any sort of fun, if I did anything at all, if I did anything, something bad was going to happen to me. And it was scary. I couldn't leave my apartment. I didn't want to drive. I didn't want to see people. I didn't want to do anything because I was so scared that something bad was going to happen to me. So I spoke to my psychiatrist and he said, I have dealt with a lot of cancer patients post treatment, and this is very common for someone to go through. If you don't get depressed, if you don't feel anything like this, it's most likely a problem because of how common it is to not be okay after cancer treatment. So I started seeing a therapist and was put on a medication. The medication ended up not working. I had a lot of bad side effects, so I just stopped taking medication. But I was seeing a therapist for a long time, and at first we kind of started talking about cancer, but then she wasn't specialized in cancer patients and how to cope with cancer. So she ended up just being a normal therapist, but I needed to see a cancer specialist that specializes in cancer patients. I needed to do that, and I wish I did it sooner. And now I'm still dealing with the repercussions of not handling it properly. I go back to Miami, and this is kind of when it went all downhill mentally for me. I felt like everybody viewed me as the sick girl and the cancer patient, and I wouldn't get invited to things. I lost a lot of friends because of it. It felt like I felt like nobody really understood how to talk to me in a way, and I became very isolated. I didn't want to be around people because I felt like everybody was judging me and talking behind my back, and everybody was talking about me but wouldn't come up to me and talk to me. Everyone was sharing my story and everyone was talking, but why weren't they coming to me and asking if I was okay and inviting me to things? And that became a insecurity and an issue for me, it felt like. So I lost a lot of friends, and of course, like the real genuine friendships that I had always stick around, and my family always sticks around. But the people that, bopped into my life when I posted on Instagram that said that they were there for me, and then the second I said I was okay and I was cancer free, they're gone. And you know what? It's frustrating and it's aggravating to look back on. Um, and I hope that their intentions were pure for them to reach out and check in. But the real people stick around. The real people check on you. The real people make sure that you're still healthy and you're still okay. And that was a big reality check for me, for sure. Um, I saw my doctor a couple times post treatment in my first diagnosis because I had another cancer scare like a year later. Um, because I still kind of experienced the same symptoms. It went away actually for a while. Like my bloating went away and my back pain went away. Of course, my facial pain went away, but I started to feel good again. I never was able to work out the same again. I still cannot work out the same again. My body is just weaker. So can't work out. Still to this day, things are different. I can't weight lift. I just feel a lot of pain in my neck, and I feel weak. My muscles feel weak and my bones feel weak. But I had another cancer scare. I would say this was probably a year and a half ago, I would say. I had another big cancer scare. Immediate blood work, immediate scans done, and everything came back normal. Um, but I still would feel the numbness and the fear and the trauma and the anger, and I don't know if that's ever gonna go away. I think it's time now that I get professional help and get in a support group or something, and see a specialist to talk about what I went through. Um, but after the second cancer scare, I started reading a book that will help me process what happened to me and talk about what happened to me. I felt like, I felt embarrassed to talk about my cancer story. I felt like, you know what, not everybody likes to hear the cancer word. Nobody really likes to hear what someone goes through, and no, some people don't know how to react to that. Some people become very awkward and don't know how to talk to you, don't know what to say. And so I just shut off from talking about it because I felt like if I didn't talk about it, then no one was going to judge me. I felt very judged. Um and like I was weird and I was ashamed. So on top of going through it on my own, I felt like I shouldn't talk about it because no one wants to talk about the cancer girl. No one wants to hear about the cancer girl's story and what she went through. And it's awkward and it's uncomfortable and it's like weird and depressing. And that's what went through my mind. And sometimes I would have conversations with people where I would open up and it would be very awkward and weird. And I would pull back from talking about it. But I started talking about it more, and I was able to work with a brand called Nasty Gal and promote a campaign that they did with Fuck Cancer. It was to support cancer awareness, and I was one of the faces of that campaign. I was on like an article on a Facebook page to talk about my cancer journey and of course posting updates on my YouTube channel talking about my cancer journey and diagnosis and how I was feeling mentally. And I received hundreds and thousands of comments and messages saying how they are thankful that I did post this journey and my process because they are going through treatment or their husband or wife or child is going through treatment and there's not that many people that understand what I'm going through, but because I posted it, they feel heard and they feel valued and that they feel that they can get through it and they can be strong enough to get through it. And that made everything worth it. That was a moment that I realized this is why I went through this. And it's annoying and it's awful, but I am a voice for other people who feel lost and feel like they're not being validated and heard. And it made it a lot clearer for me after posting all my content and being a part of a campaign. It made everything somewhat more okay with me to process. So that is kind of what happened a year after my treatment. Um, I'm going to jump ahead to most currently. I'm sorry if I'm skipping some things. It's really hard to talk about and it's hard to remember a lot, every detail at least. So I would say a year ago now, um, maybe less than a year ago. We'll see, less than a year ago, I start feeling sick again and worse than I did before. No face pain, obviously, but the back pain and the nausea and the fatigue and the joint pain and the joint swelling. And I knew that there was something wrong again. I got updated scans done. Everything looked clear in my chest and my face. I got blood work done. And I also want to say, I'm going to actually take this back to before I was diagnosed with cancer. I remember talking to my mom one day. I got my blood work done. I remember getting in the car and I remember telling her, I know I have cancer. I know it. I just need someone to find it. Someone needs to figure it out because I know in my soul, I know deep down that I have cancer and I know and I'm not crazy. I know what I'm feeling is not my mind. It's not I'm stressed out and it's making me sick. I know I have cancer. I remember it so vividly, me saying that and my mom saying, you don't, you don't, you don't, you don't, you don't. All the doctors are saying you don't, so you don't. But I knew I did. And that is how you trust your gut and you trust your intuition. You never give up on your health. You never do. Because I knew. And it's crazy to look back on. It's crazy to share this story. It's so crazy. So, anyways, fast forward to now. I feel sick again. So, my mom told me I should go to this doctor that she goes to. She does like these thorough blood work, thorough blood work exams to see if anything is off, any level at all is off. I get this blood work back. My progesterone is low. My estrogen is low. My testosterone is low. My thyroid is weird. Everything is off. So I get put on hormone creams, antibiotics, supplements. I was taking like 6 different things every single morning. And it wasn't working. Like it was not doing anything different. Nothing was changing. I was feeling the exact same. So I get more blood work done. And the levels are a little bit better, but still kind of off. But I start seeing another doctor, and she said, just get off of everything. This is not working. And this high of medication and hormones. These are for people who are going through menopause. You're 20 years old. I know I was 22 at the time when I was seeing this doctor. 21, 21, 22. And clearly it's not working. You need to get off of it. So this is jumping to now, current. I see a head and neck doctor um to just make sure everything is okay because I'm not feeling good. So I see this head and neck doctor. It's difficult because now when I go into doctor's offices, I kind of shut down, and everything that I go in that I'm going to ask, I just forget to ask the questions because I just go numb and I freak out and panic a little bit. So I tell him what's going on. He says, let's get an MRI done of your face and we're going to do a CT scan of your chest. My face comes back okay. There's one lymph node that looks a little weird, but it's fine. Um, I have a I get told I have a cyst in my pancreas that they caught on my CT scan. So all the fear, all the stress, all the anger, all the numbness, all that trauma revisits me again. This is recent, you guys. This is very, very recent. In my last episode, my first episode, I talked about getting the results. Well, I did get the results back, so we're going to get into it. So, I have to see a pancreatic and liver oncologist, and I see her. I get another MRI done of my pancreas and of my pelvic area. I get a blood work exam, a thorough blood workup that has tumor markers in it, and then I get a genetic testing cancer blood work test done. And then I get an endoscopic ultrasound done, which is where they put a tube down your throat with a camera. They look at your stomach, they look at your esophagus, your gallbladder, and then if it's safe enough, they will biopsy the cyst. So in the span of I think it was like a span of a month, I was getting all these tests done. The I was losing my mind. I went back to that place that I was when I first got diagnosed with cancer all over again, but 10 times worse because I knew the outcome last time. So I felt like I would know the outcome of this time. I was convinced that I had pancreatic cancer. I was like, there is no way that I don't have pancreatic cancer. I just went through something that was so rare that nobody believed me for, that still to this day is so rare. How would I not have pancreatic cancer? I'm 23 years old and I have a cyst in my pancreas, which is already rare enough. I do. I am mentally preparing myself that I have cancer, that I'm going to go through chemo, that I'm going to go for radiation. I'm mentally preparing myself, and I was driving myself insane. I couldn't sleep. And when I say what really pushed all my doctors to seeing me was I can't smell things. I wake up every single day so nauseous. I want to throw up every single day. Like I said, I can't wear perfume. I'm losing so much weight now. I I'm bloated, back pain still, but it's the nausea. I am so nauseous. So we're thinking, okay, well, if it's not pancreatic cancer, maybe she has ulcers in her stomach. There has to be something going on because this is not normal. I do all these tests. I'm so angry and I'm sad and I'm frustrated and I'm going crazy. I'm going actually crazy. So on last Monday, all my results came back. I go see my pancreatic oncologist. The pathology report comes back not malignant. No cancer cells in the cyst. It seems to be that it's very confusing because it seems like it's this one kind of cyst. In the pathology report it says it's this, but it looks like it's this. And this, well, if you guys aren't seeing the visual on the video, the pathology report came back as not cancerous, it's this kind of cyst. But the look of it looks like it could be a precancerous cyst, but there is no way of telling if it's a precancerous cyst without waiting and seeing if it grows more like it, which means I wait. And in 6 months, I do another test to make sure it's not that. But in the meantime, we're still figuring out what could be making me this sick. So I have a PET scan next week. I have to make an appointment with a regular medical oncologist that's not just a specialist in one area. And have to see a gastrological, is that what it's called? Just a gastro doctor, the person who looks in your stomach and deals with all of that kind of stuff. I have to see him again. And then in September, I have to see my face oncologist. And again in November, like I said, I have to see the pancreatic oncologist to make sure it didn't turn into the precancerous cyst that she was explaining. So my mind is, I'm going crazy, I feel like. I feel like I can't catch a break with my health. And it's amazing that I don't have pancreatic cancer. It is a blessing. And I was so convinced that I did. So the fact that I don't is, it's a miracle right now. Like the thought of going through chemo and surgery and radiation would be awful, and it's devastating. People who have pancreatic cancer, it's devastating, and it's an awful thing to go through. And so it's a blessing, and it's taken me a couple hours and it's taken me a couple days to kind of realize, like, it's not. You're okay right now. It's not. So take in that feeling, take in that knowledge that it's not pancreatic cancer, because once you go through cancer once, it's like, I don't believe you. I don't believe any of you doctors. I need proof that it's not. And the pathology report proves that it's not cancer. So now it's just time for more tests to figure out what's wrong with me, which is a never ending battle, it feels like. I feel like there's always something going wrong, and there's always something that I'm dealing with when it comes to my health. So now we're just waiting and we're figuring it out, but I need to be thankful and grateful that it's not cancer. And I didn't feel grateful or thankful that it wasn't cancer in the moment, because I didn't believe anybody. But now that I'm talking right now, I need to remember and be grateful that it's not, because nobody wants to go through that. And I need to be blessed. And I'm going to figure it out. I'm not going to stop until I figure out what's going on with me and my health. And I'm not going to be told it's mental and it's stress. I'm not, because I know that there's something going on and we're figuring it out. Slowly but surely, I'm going to have it all figured out. So that right there is my entire cancer story and journey. And I might have skipped some parts and some gaps, but please forgive me. It's a lot to talk about and explain, but I'm going to be okay. And it's frustrating. It's so frustrating. And I want to talk about jumping back to your regular life after being diagnosed with cancer. There is no jumping back to a life that you once had post cancer. I was so eager to get back to this life that I thought I was missing out on, and I wanted to get back to this life that I once had, and that's not what's ever going to happen. I'm never going to forget about what happened. I'm never going to forget about the trauma and being this normal 23-year-old girl. This is my life. My life right now is getting answers, going to the doctor, and being healthy. And it's okay. It's going to be okay, because there's no other option than to get through it and fight for your health. This is the path that God has planned out for me, and it might not be the path that I wanted, but this is it for me. This is what I'm always going to have to do, I'm always going to have to get tested done. I'm always going to have that worry deep down. I'm always going to. That's never going to go away. But when you remember that you're doing everything that you can to help yourself, if you're doing everything that you can, there's nothing more that you can do. And I need every single person listening to remember your health is all that matters. So don't ignore it. I know going to the doctor might be a pain. I know it might be a drag. And I know that maybe it might not be the answers that you want. Maybe it might not be the news that you want. But learn from my experience. Learn that fighting for your health can benefit you, because if I waited years and years and years to get tested, if I listened to some of these doctors that told me that I was okay, I would be in a lot worse shape than I would be right now. I know for a fact, if I waited, I would not be able to move my face. I would not be able to smile. I wouldn't be able to live the life that I live now if I didn't speak up and fight for my health. Because it's all that matters. And I know I've said this multiple times, but if you are going through cancer treatment or you're in remission, it's going to be okay. And we're in it together. You're not alone. You are not alone. And there's so many people that understand how you feel. This is my journey, and it's not ending anytime soon. And I know I'm cancer free right now. But it's still scary. And I pray that my PET scan comes back clear, and I'm sure it will. But it's kind of funny. This is why I made this podcast, is we go through hard things in our lives, and sometimes it's not typical for a young 23-year-old female to be going through something like this, or it might not be normal, or it might be, like I said, not typical, but this is what you go through. This is what can happen. And we learn to embrace it and keep on pushing and be thankful for the little things that we do have. I forgot to say what I'm lucky for today. I'm lucky that I'm able to sit here and talk about my story, and I'm lucky that I'm able to smile properly and move my face properly. That's what I'm thankful for. And I love you all, and I will see you all in my next episode.